the lady earned health returns. She did not pay any premium. She just paid the GST next year. And when we asked her, she said, I have become healthier. I wanted to be fitter. I've lost weight, so I'm feeling good. And this was in a small town, let me tell you. But she said the best thing that happened to me was that, the whole day I did 5,000-6,000 steps. So did my husband. And at the end of the day, we both realized, oh my God, we have to do 4,000 steps. And me and my husband walked together. And that's improved our time together. We spend more time with each other. And I want to thank ABHI for that.
Yeah.
It is so touching and heartwarming to hear stories like that. And that's what we are proud of.
Hi, I'm Darshana Shah, and I welcome you all to In the Spotlight, a podcast by Aditya Birla Capital. In this podcast, all our viewers are going to learn and benefit from the conversations with our experts and leaders across our business solutions of loans, investments, insurance, payments, and cards. Today's episode is really special because we are not just talking about the wealth aspect in our lives, but also something very important, which is health. Fortunately now, Indians have started taking their health seriously, but we still have a long way to go. 54% of Indian adults are physically inactive still, and mental health issues are on the rise. So together, a lot has to be solved for our country. But I'm happy to tell you about this business which has done amazing work for keeping families healthier. And I'm very excited to present to you the three amazing trailblazers and women leaders from Aditya Birla Health Insurance. I have with me Anuradha Sriram, Varij Pujara, and Anuraj.
I'm so excited to be in the spotlight, Darshana. Thank you.
Thank you for this wonderful initiative, Darshana.
Thank you so much, Darshana. I've always wanted to have coffee on a couch, so thank you for having me.
Oh, I'm very excited to have you all. And even our viewers are very excited. They have lots of questions, so let's just get started. See, one of the important things, when we discuss health, is that we women always tend to deprioritize our health. And I don't understand why we do that. And if you see the data, still 54% of Indian adults are physically inactive. Mental health issues are on rise. These young ones were only looking out for their health as a fad. But today, post-COVID, we see them more and more serious. They are making right health choices. So Anuradha, just tell me that I know that Aditya Birla Health Insurance has changed the category narrative. The category which was only talking to the sick ones or people who were really in the older age. But here I see that you all have changed the narrative. You have younger lives in your portfolio. So how did you guys go about it?
When we entered into health insurance 8 years back, we were the last ones in the category, and the choice was very simple, that we had to do something that was putting customer first and looking at it from a customer point of view in a category which was very transactional. Distributors just told the consumer that आपको कुछ होगा, ये policy लाके रख लेना आप, आपको मिल जाएगा. And they sold, they forgot, the customers bought, they forgot. And unfortunately, if a claim happened, then they went scrambling for the cover. It's a very transactional, very buy the product, forget kind of category it was. So our purpose was born, which is really about prioritizing health and how we can work with the consumer to make them first aware of their health. The natural tendency for people to go and proactively do a health checkup, to know what their clinical parameters are, which is indicators of early onset of anything. We are so happy we are champions of change in that context, that customers are going and doing that health assessment.
It is good to know that you are actually making consumers go out and do their health checkups on time.
Because with that, the customers are becoming aware of their health, they are taking action to improve their health, and the customers can get their entire premium back. What better proposition does a customer need to be told that you take care of your health, we give your protection for free. That is our promise to the consumer.
Isn't that exciting? So to all the youth out there who are watching this, you are fit, you are looking after your health, you are making right health choices, and here is a health insurance who is giving you 100% premium back. But coming to you, Anu, so you know how these young, the young consumers are. They've never understood the conversation around health insurance. They find it very confusing. There are jargons, and that's why it is almost like only 4% of Indians are actually, so the category is, less than 4% penetrated. So how have you changed to, make your communication more fun for them?
We've done a bit of a disservice to the consumers because, as an industry, we've always spoken down to the consumer, or, we've spoken in the language of fear. कि मतलब accident हो जाएगा तो तुम्हें health insurance चाहिए होगा. And nobody wants to really acknowledge the frailty of being human, right? I think the wonderful thing about Aditya Birla Health Insurance has been, and like Anuradha mentioned, we were the last ones. And how do you move the needle from not wanting to have a conversation about health insurance to having a conversation about health wala insurance, right? And I think that has been the change that we've tried to kind of drive in the category. We don't speak the language of fear. We are health first. We want to empower you. We want to give you the entire ecosystem that you might need if you are focused on your health, right? And honestly, we are a category that consumers are not impulsive about. You don't wake up in the morning say कि आज मैं health insurance के बारे में पढ़ना चाहता हूँ,
true,
right?
absolutely.
With the kind of content consumption that the consumers are doing, you have maximum like 3 to 5 seconds to put your foot in the door to have them engage with you, right? What we've been able to do is create content which consumers use, which consumers see when they're not thinking about us, right? So we use the health first conversation, we create fun communication, we create moment marketing which is trending, we use trending audios which really sometimes my team shows me and I have absolutely no understanding of how it will work, but it works because that's what the consumers are consuming, right? In the hope that when they do think about buying health insurance, we will be in their consideration set. We will be seen as a brand that communicated simply, de-jargonized health insurance, spoke health first, and therefore, you are going and speaking to a brand that is not only going to take care of you if you fall sick, but is also going to be a friend, a guiding light, a support system in the event that you want to focus on bettering your health parameters. So I think that's been a fabulous journey for us. It's nice to see consumers engage, and it's nice to see consumers take up the contest that we do and tell us what have you left behind when you started your health journey. And this was a campaign that we'd done about a year back that maybe we can speak a bit later.
But so this is interesting that your is a health insurance, health wala health insurance, जो de-jargonized कर चुका है. It's making the language simple for the young and the the fit ones out there. But now I'm going to change the track a little bit, Varish, because what we've seen is Aditya Birla Health Insurance was the late entrant in this whole category space. But today it is the fastest growing health insurance, and obviously that comes at the cost of having a large distribution. So tell me more about that. How have you gone about building that large scale distribution for people to buy health insurance?
When we started, health insurance was always about people between 35 and 55 saying, I need to buy health insurance. They suddenly realized they're growing older, and that's how it worked. People younger than 35 said, mujhe kyun insurance chahiye? And people older than 50, 55 mostly had some conditions, some chronic conditions, and wouldn't get health insurance or would get it at very, very, very expensive costs with waiting periods, so on and so forth. So when we actually entered India, we decided that we would expand the pie. We would expand the market. And like both the Anus mentioned, we reward healthy behavior, and the younger generation is more inclined to buy when they know that they're going to get something back. They know that the organization is prioritizing their health. And at the same time, we launched products for people greater than 50, 55, where we covered chronic conditions. We fondly call it ABCD. There's a lot more to that: asthma, blood pressure, cholesterol, and diabetes. The whole idea was to expand the consumer segment, focus on the customer. And then we went to distributors. We focused on both traditional and non-traditional distribution partners. In traditional, we have our agents. We have over 1 lakh of agents today who sell for us and who are very proud of our health first approach, really proud. We have agents who are women who talk about Rakho Pura Khayal, which was one of the campaigns that we ran, where women anyway take care of the food that the family eats, the medicines that the family takes, the exercise that they do. Why don't they prioritize health insurance as well?
So true.
So we have agents, we have banks, we have 18 banks working with us, and these banks were also very excited with our differentiated value proposition for their customers. And we went and pitched to them that you're taking care of the financial wellness of your customer. Why don't you take care of the health needs of your customer? And that was exciting for them. That was different for them. We work a lot through the direct, online, digital and telesales, but I'm really excited about the non-traditional channels as well.
Tell me more about that.
Non-traditional channels who focus on health of the consumer. For example, a gym. Could I sell insurance through a gym? For example, nutritionist. Yeah. For example, somewhere where people come to buy, even websites where people come to talk about health, buy health-related things, all around health. So I think those are non-traditional channels as well, where we do see that the health-first approach is really, really, liked by the consumers.
This is really exciting. Now you can go to your nearest gym, or you go to a bank, or you go online, and Aditya Birla Health Insurance is available. This is like almost saying कि अब movies release हुई है तो हर cinema घर में मिलेगा. उसी तरह आदित्य बिरला हेल्थ इंश्योरेंस आपके इंडिया के कोने कोने में मिलेगा. More than 4,000 cities and towns that you are selling. Varish, excellent. It is fantastic. Varish, you brought a very important aspect of this whole lifestyle condition and what you spoke about, ABCD. And as we know that India is actually the diabetes capital. So tell me something, and specifically in Aditya Birla Health Insurance, how are we doing it differently? Because I know this category rejects people who have any condition. So Anu, tell me Anuradha, how we've changed the product for people having lifestyle conditions.
We really looked at our products, our go-to-market, our communication, everything from a consumer lens. And we wanted to change the narrative, which is you take what we give. What you want sometimes is about what I am aware. What you need is about what you actually need. So that is where we really deeply researched in terms of what was available in the market to such consumers with pre-existing conditions. And look, at the end of the day, there is enough research to show that if a customer with a diabetes condition or hypertension, they manage their condition well, their chances of getting hospitalized reduces from almost 7 times that of a healthy consumer to literally as close to that of a healthy consumer. And even for the distributor to say that I go to a consumer and if in a family there is one with a pre-existing condition, one who is healthy, I'm not able to cater to the entire needs of the family, which is very unfortunate. So it is really about giving a holistic solution that is catering to every type of consumer, that a distributor can go and confidently present to the consumer, and the consumer to have that faith in a brand like Birla and get a good and hyper-personalized cover. So that is where we really worked on. And I'm very happy to say that there are stories of consumers who come and told us that because of this offering and us continuously nudging and working with them, they've been able to bring their levels of sugar down, cholesterol down, and because of which they're able to lead a much more quality life.
So Anuradha, I also read that you all have something called as care managers. So what is that all about?
We've had experiences of a few of our care managers going beyond their call of duty. They don't even think it is their jobs. We had this one instance of a lady, an elderly lady getting hospitalized, and the son was away in the US, and our care manager actually went and stayed with the lady overnight, and she took good care of her.
Wow.
Can you imagine the kind of the relationship and rapport that you build with the consumer with this kind of the care and
there's so much care and
yes,
personal.
the rapport. So we are very proud of what we are doing to our consumers here, Darshana.
Really nice. So here is a, insurance company who is now also, it's insurance for all. It is not just for young and healthy, but it's also people who have lifestyle conditions. So from there, Anu, I want to come to you that what interesting work that I see what ABHI has done. You all have this community. So it's literally creating a tribe for yourself. So can you tell us what is this community all about?
Yeah. Darshana, actually it's very interesting, and our ethos is that we're a health first brand, right? But that does not mean that we are a brand only for people who are inherently healthy. Like Anuradha has mentioned, we've created products around people who have chronic condition, and apart from the products, we've created an entire ecosystem, right, where we help them, we guide them, we nudge them, we have care managers who guide you on how to manage your diabetes better, etc., etc. But of course the consumer has to want to do it, right? We can't force you to use our ecosystem. In line with that, we've also created this community, it's called Active Living, where we have the most interesting content about mental health. We have content around nutrition, we have content around lifestyle diseases and how to manage it better. Very, very happy to share that we have roughly about 85,000 odd subscribers, and we add more and more subscribers every day. And the best part is that this content is not restricted to only our consumers. This is available to anybody who wants to read, and it's vetted by industry experts. So we have doctors and nutritionists and lifestyle experts vet the content that we put out. And the entire idea is that if you're putting your health first, if you care about your health, please use this resource of ours. You don't have to be a customer. If you become a customer, we will give you the power of the ecosystem to you. But even if you just want to consume content that can better your health, that can better your fitness, that can give you advice on nutrition, please use the Active Living blog that we have.
It's really interesting. Varish, I want to come to you that whilst we spoke about this entire, that you get 100% premium back if you're staying healthy, but how does it actually work? So the viewers are actually asking that, somebody said that, is it even true?
So Darshana, it's a very interesting question. And we have an app which is called an Active Health app. And we have over 1 million customers who are using it today.
Wow.
The whole idea is for the consumer, once he becomes a consumer, to know his health, improve his health and get rewarded. These are our 3 mantras. We live by them. So the minute you buy your policy, you actually after that do your health assessment. And I think we are the only company as far as I know who actually does a digital health assessment. You can scan your face, you can know your health parameters, and you start on your health journey. A lot of consumers don't know when they have something. But we know that when consumers know they have something, they start taking care of health. So it's about knowing your health and then working on improving your health. You can improve it either by walk 10,000 steps a day, burn 300 calories. There are different ways that you can improve your health, and then we reward the consumer basis their activities. We give them up to 100% of premium back as health returns. And it's interesting, but we've actually tracked 154 billion steps this year.
Wow.
As an organization. So
I think it's a fantastic number to, it kind of gives me goosebumps when we have numbers like this thrown around.
See fastest growing, I feel very happy. But when I see the consumer engagement, like Anu mentioned earlier, it was just sell and forget. We are selling and engaging, and this is a real proof where consumers are coming to our app, downloading our app, doing the health assessment, walking, gymming, doing whatever, everything else to keep themselves healthy, and taking the premium back. And it's not about premium back. I just want to tell you a wonderful story, one of our customer stories. The lady earned health returns. She did not pay any premium. She just paid the GST next year. And when we asked her, she said, I have become healthier. I wanted to be fitter. I've lost weight, so I'm feeling good. And this was in a small town, let me tell you. But she said the best thing that happened to me was that, the whole day I did 5,000-6,000 steps, so did my husband. And at the end of the day, we both realized, oh my God, we have to do 4,000 steps. And me and my husband walked together. And that's improved our time together. We spend more time with each other. And I want to thank ABHI for that.